This episode is going to give you updated information on veterinary neurology, a field many owners and even vets find pretty intimidating, until the logic behind it becomes clear. Today, you'll take away a better understanding of what a neurological referral actually means, how far a good history can take us, and why MRI is sometimes essential, and what common neurological conditions really look like in real patients. I'm your host, Dr. Cara, a veterinarian based in Hillcrest, South Africa, who believes complex topics often become more manageable when we explain them simply and honestly. My guest today is Dr. Ane Uriarte, a board-certified veterinary neurologist and neurosurgeon who has trained in Europe and the US and who founded NeuroNovet based on her belief that we learn better in a team with friends. If you enjoyed this episode, please like, share, and follow. Now let's get started. What is the sort of plan of action once their pet has had a seizure?
If your animal is less than 6 years of age, it's very likely that there's absolutely nothing to worry about. So if this was a first seizure, you may want to see, okay, let's see when is the next seizure and if we have a second seizure. But if your dog is over 6 years of age, don't wait for the second seizure. It's very likely that there is an underlying disease. Many people think that a seizure will happen when an animal is stimulated, and it's the other way around. It's much more likely that your dog or cat will have a seizure when they are sleeping. And I know this is difficult because you want to make your dog or cat feel better, but nothing you can do to your dog is going to make that seizure stop. Nothing.
A very warm welcome to the podcast, and thank you for being my guest today. This is definitely a very fascinating, but a very daunting subject for many pet owners, especially when they're told they need a neurology consult. So I can imagine you deal with a lot of fear when you get referrals.
Yeah, definitely. Thank you so much for inviting me, and hopefully I can help a little bit pet parents to be a little bit less fearful and to be a little bit more comfortable when they go to see a neurologist. That I understand that always is a little bit daunting and it's scary. So hopefully we can help with that.
Yes, I hope so. So I suppose let's start at the very beginning. How do you explain what you do for a living, and you know, what do you explain in terms of your role?
So I think that is quite nice to see how people reaction, the faces that they put when I say that I'm a neurologist for dogs and cats, because mainly, although we do treat all the different species, it's true that in a vet hospital, we do mainly dogs and cats. And people say, oh, so dogs and cats have neurological problems. So basically, to keep it a little bit simple, I say, okay, so it's not about being crazy. It's not about having a behavioral problem. If your dog has a seizure, or if your dog is or your cat is paralyzed, or, for example, your dog or your cat has a brain tumor, then I'm going to fix that. Mainly, I think that people understand a little bit better when I talk about neurosurgery, when I say that I remove brain tumors, that I remove sleep disc, and I make taxis walk again. So that's what I tend to say, because then you see their faces lighting up and say, oh my God, how interesting is that? And of course, we do some other things that are not that interesting, but that part is quite rewarding.
And tell us about your journey. Where did you qualify and how did you end up on this path?
Yeah. So I'm originally from Spain, but actually I've never worked in Spain as a vet. I did my first 4 years of university in Spain. Then I went to do my last year of university as an Erasmus in France, in Paris. And from there I did my rotating internship. And then I did my residency, my European residency, because I'm a board European certified in veterinary neurology. And after being 6 years in Paris, then I moved to the UK. I worked in a private practice for about 8 years. Then I moved to the States. I was a professor at Tufts University in Boston for over 4 years. And then I've been back to England for the last 5 years. So this is where I am at the moment.
Oh, wow. So you really have worked in every country and experienced different peoples and different approaches to it. But that's phenomenal that you've ended up in the UK. And obviously a real need for the work that you do. I'm going to speak from complete experience that there is a level at which, unless you have a special interest in neurology or you have the facilities or equipment to work up these cases, you do feel like you reach a certain limit, and then you go, not only do I need a specialist, but I need it quite urgently, because these are not cases that generally can wait. Is that what you find?
Mm-hmm. Well, and that's where I have I teach a lot all over the world. So I go to Asia, Latin America, do a lot of courses, and I have quite a lot of activity on my Instagram, ane.neuro and neuronavet. And I've been doing this for like almost 10 years. And I put a lot of my cases. Everything is for free for vets to learn and also for pet parents to understand a little bit more. And also have a TikTok where I try to be a little bit more simple because many things are not that urgent. They are scary. And when you see your dog or your cat having a seizure, it's really scary. And there's a lot of things that we think we need to be doing, but you shouldn't be doing. So I try to teach a lot on my Instagram about that. Neurology is scary, but not as urgent as we think, especially with back problems. And that's what I try to do on my daily teaching. Try to calm everything down, and we can really make decisions that benefit the patient and also benefit sometimes the pocket of the pet parents, because neurology can be really expensive.
Yeah, that's a very good point. And I think often the urgency comes from us going, I don't know how to best support these patients, and obviously having an understanding of what you can do in the interim, potentially between actually seeing them and getting them a referral consultation is really important, isn't it?
Exactly. I think that I try to a little bit divide my teaching on ane.neuro being a little bit more for vets, that they feel more comfortable with their neurology cases and they don't panic. And then neuronavet and my TikTok, ane.neuro, a little bit more for pet parents, that they understand a little bit more, seeing some signs, and then at least they understand that they may need to go to see a neurologist. Both together, we need to be able to give the best care that we can for our patients and for our babies, of course.
Of course, very much so. And I mean, the cases that you're seeing, obviously you deal with dogs and cats. You made mention we do see neurological cases in other species, but with pet ownership, are you seeing the same kind of cases over and over? Are these typical things, or is there a way to manage predispositions with, advice on breeds and breeding and sort of, preventative measures? Is that something that you educate on?
Yeah, exactly. That's exactly what I educate on. A lot of these trends about what are the breeds that I love, but the breeds that probably I will be a little bit more nervous. So I will have a good pet insurance if I have them. Yes, exactly. I also do a lot of teaching about not being scared when an animal has a brain tumor. For example, there's many things we can do. There's many things that we can help that patient to have the best quality of life. I think it's important that we know we are prepared as a pet parent when we're going to have a new breed of dog. We need to also be aware, depending on which country we live, what are our possibilities in terms of pet insurance, what are the costs of potentially problems that this baby that we're going to have could potentially have. So we have a decision that kind of a well-thought decision when we are adding another member of the family.
Oh, absolutely. I mean, there are obviously, you say breed predispositions that have come to light, particularly with, more publicity around the Kennel Club and various associations sort of saying they recognize this and this is something that we can manage. I must say I was living in the UK and I ended up with a Basenji, thinking that was great living in an apartment to have a dog that couldn't bark. He definitely could make a noise. We didn't realize that was still possible. Yeah. But the unfortunate thing is that this dog ended up with seizures and idiopathic epilepsy. Mm-hmm. And I know, obviously, and I'm grateful for that experience in some respects because I also know how panicked owners can be. So I thought that maybe we can talk about some of the common examples, as I know we don't have a huge amount of time. And then we can possibly deep dive into some of these conditions later on in a podcast. But, the neurological cases can present in multiple ways. You made mention of the seizures. What are some of the other things that might indicate, hang on, this is a neurological issue rather than, for example, pain or a heart issue? How do you get owners to distinguish, and what's the best thing that owners can do to come with the information to their vets to assist?
I think that regarding seizures, there is a very good questionnaire that I like to use. I think that seizure, the risk for the seizure is that the majority of us, we have heard that word. So it's sometimes maybe overused because everyone knows the word seizure, right? And sometimes, as you said, we can have an animal that has a collapse because it has a cardiac disease. And a cardiac collapse will be something that is much shorter than a seizure, that it will be happen when the animal is excited, and it will not have a certain post signs that a seizure has. So, for example, a seizure. Many people think that a seizure will happen when an animal is stimulated, and it's the other way around. It's much more likely that your dog or cat will have a seizure when they are sleeping. The seizure is going to be very short, less than a minute, okay? Probably you may have some salivation, some urination, so we're going to need to have that information. And it's quite unlikely that your dog or cat will have more than one seizure a day, okay? So those are the questions that we're going to need. When did it happen? What was your pet doing? What happened after? How long did they take to recover? How long it lasts? Did they urinate, defecate, or salivate? Those things are the most important things for the seizure. And that is going to help us making a difference. Could it be something cardiac? Could it be something more complex, like now is very trendy, which is paroxysmal dyskinesia? So those questions, when, how long, what happened before, what happened after, is the most important thing. And if you have the chance to take a video, that's amazing. The video needs to be as far away as possible from the animal. And I know this is difficult because you want to make your dog or cat feel better, but nothing you can do to your dog is going to make that seizure stop. Nothing. They're not going to bite their tongue. Nothing is going to happen. The seizure will start and will stop. That's what happened with seizures. So if you feel like you can take a video, you take a video from far away as long as you can. But still with a video, I'm going to need all these 5 questions. So it's important to give that environment, that context, what happened around that episode. And for any other neurological episode will be the same. When did it started? How it has progressed? What happened before, after, during? Just description, okay? And I think that we all tend to go to Google or whatever, and then we want a diagnosis. And what we want as a specialist, we just want objective information. Then we will use our ChatGPT inside our brain to come up with the diagnosis. We just want very bland, plain information. I saw the dog moving the legs like this or like that. Very, very objective. That's what we need.
You look at me, I look at you. I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
And before we move off the subject of seizures, can you give us the kind of, especially as GP vets, the kind of things that you should consider when you have an animal presenting with a seizure the first time?
Yes. So as a vet, of course, after you gather all that information, the most important thing, and I will say the sole thing that you need to focus, is the age of the animal. If your animal is less than 6 years of age, it's very likely that there's absolutely nothing to worry about. And this is just idiopathic epilepsy. So if this was a first seizure, you may want to see, okay, let's see when is the next seizure and if we have a second seizure. But if your dog is over 6 years of age, don't wait for the second seizure. Because if he's over 6 years of age, it's very likely that there is an underlying disease. So that's the point where it's completely opposite direction, right? Less than 6 years, let's wait and see if it happens again. Okay, we may want to do some bloods to take a baseline, but we don't need to freak out. If it's over 6 years of age, we don't need to freak out, but then we need to start anti-epileptic medication and we need to see why that happened, because it's very likely that there is an underlying disease. And if there is an underlying disease, we want to treat with anti-epileptic because that is likely to happen again.
I understand. And obviously, we probably don't have the same situation in the UK. I know, having practiced there, I didn't come across this. But in South Africa, we do have toxicity as one of the common causes of us seeing or being presented with a dog seizuring. How do you manage that differently to, sort of the typical presentation of the one-off? And what is different about those cases?
Yeah, so an animal that has an intoxication is not going to present just seizures because the the toxic has entered the body and is going to go through different organs, the kidney or the liver. So we are going to see other presentations. And depends again, what is the type of intoxication, but one of the most common is organophosphate intoxication. The animal is going to be very shaky, very tremory. There's going to be something else happen. We don't have an animal that had just one seizure and comes completely normal walking through the door. So we will focus on the other symptoms. The seizure, yes, sure, we want to stop it. We want to treat it, anti-seizure, anti-epileptic, but then we need to understand what else is happening in the body, how the kidney, the liver, the blood, the oxygen is doing. So I will say that probably we focus most on balancing those. The seizure, we just need to, again, we're going to treat them. We're going to treat all the seizures the same. We're just going to try to stop them, okay? That is one thing. And the other thing is like, why are they there? And depends on the reason why, the treatment will be a little bit different. In the situation of toxic, will be just supporting that body until the toxic goes away. At least it's a toxic that we can, reverse, which is not that common. I guess that in South Africa, you will have obviously some snakes, and that I have nothing about. I know nothing about. I just only know a few names of big snakes that you have, but I have no idea how would you do it if you have a snake bite.
Most of those are supportive care or anti-venom. So yeah, very, very true. But when one of the things, it's definitely getting better, but one of the things earlier in my veterinary career when I was dealing with a lot of emergency cases is this desire to, as you say, the fear of them biting or swallowing their tongue. Where does that come from? And how often do you see owners bitten by their own dogs fiddling with the mouth during seizures?
So thanks God we don't see a lot of biting anymore, because I think that the message is going through. Yeah. I think that maybe originally that is there has been kind of the fear with humans biting their tongue or swallowing their tongue, or I guess getting obstructed by their tongue, but that's not going to happen to a dog. I think that little by little is getting there, where the majority of if we understand the majority of the dogs will have a seizure because the amount of neurotransmitters they have is not enough to actually stop the seizure. And it tends to happen when they are relaxed. So actually turning on the lights off and leaving them calm is almost like the opposite of what you should be doing. But to be honest, anything that you will be doing outside other than medication will stop the seizures. So basically, a dog that has idiopathic epilepsy, the brain is always in activity, right? And the neurotransmitters are controlling and balancing that activity. When the animal goes to sleep, then the body says, okay, you're relaxing, I can calm down. And that's when the activity takes over. So that thought of that we need to keep them calm, it has no fundament either. They're not going to be swallowing their tongue. And what we need to do is just making sure that they don't fall downstairs, they don't fall into a swimming pool, for example, that they don't bang their head against a corner. That's the only thing we need to do. Nothing in the face, just let them finish. They will have the seizure. The seizure will suddenly stop, and then they will feel a little bit what we call post-dictal, a little bit disoriented. You need to help them not to walk into things. But unfortunately, there's nothing you can do other than give it a medication to stop that seizure. So you need to make sure that they are safe and you are safe.
One of the other things that I've seen, particularly because we have multi-pet households and, dogs sometimes unsupervised outside, they, live in a warm climate, is that, and you spoke about the pre and the post-ictal, is that these dogs are sometimes attacked by other dogs in the household. Is that because they're behaving differently? How frequently do you see sort of injury associated with seizures?
Yeah, I see that a lot. And sometimes also when I'm a little bit insecure about if an animal has a seizure or not, because sometimes with partial seizures can be a little bit tricky, I ask about that. There is definitely, I can see particularly in young epileptic dogs, that their behavior with other dogs changes. So the other dogs, they feel there's something wrong with them. And you can see that these young dogs, they get really bullied in the park. and you see that all the dogs, and I ask this question, do you have the feeling that now your dog, the relation with other dogs is a little bit worse? And they say, yes, certainly. Doesn't always happen, but is a possibility. I don't know what it is. You know that there is a lot of dogs that they are sentinel for human seizures. So they sense that a human is going to have a seizure. So I do think that obviously the friends sense that there's something smelling fishy. The neurotransmitters in that dog are not well balanced, and they don't want to be around. I see that often.
Yeah, interesting. And what do owners do? So you've explained obviously during the actual episode itself. What is the sort of plan of action once their pet has had a seizure? If you're saying don't rush, you don't need to bring them on, it's not going to last that long. They don't, unless it does continue for this period of time, they don't have to get in the car with their seizuring pet. What is the plan of action afterwards? And what can they expect?
Yeah, I think that when you are a pet parent and your dog has a seizure, you're certainly going to want to discuss, especially when it's the first time. You're going to want to discuss with a vet, 100%. And I guess that depends a little bit what's your personal situation. If you think that you can at that time go to the vet and have your dog check or your cat check, yes, of course, that's going to make everyone feel better, because you need someone else to tell you, yes, everything is fine. So if you can do it, great. If for whatever reason you can do it, and that seizure has lasted less than a minute, which is usually the case. I know it's going to sound or feel like it's forever, but rarely lasts more than 5 minutes. Then you can just let your dog calm down. You're probably going to need to make sure that he's going to want to eat something or drink something. Usually they get a little bit restless afterwards. And then you may want to spend the rest of the night with them, just because it's going to make you feel better to know if he has one or another, or if he's only one. And then just book an appointment with your vet, with your regular vets. And then they will be able to help you and say, okay, look, this is the right age. Let's wait for a second one, or it's not the right age, or we have other things that are making us suspicious. And then we're going to need to refer you to a neurologist. That would be probably my general advice.
And before we move from the head and down, because obviously neurology is wider than just seizures and brain activity, what are the tools and what is the workup in terms of, if you're trying to determine that this is, we've established this is not idiopathic, this patient, what are the kind of baseline things that you need, and what further investigation do you offer your clients?
Yeah, so we recently have some guidelines that they were published with a group of neurologists that together they decide, okay, these are going to be the level of confidence that we're going to have to diagnose idiopathic epilepsy. So you diagnose idiopathic epilepsy by having an animal that is normal between episodes, that is between 6 months and 6 years of age. And then you have different levels of confidence. One will be just by having 1 year without progression, no other investigations. Other will be just having basic blood work and bile acids and urine test. The next level will be if you add on the basic bloods, bile acid stimulation, urine test, and MRI of the brain. And the last one will be if you add the encephalogram. So you just need to put all the needles and record the brain activity. But as you can see, we could actually diagnose without an MRI and even without blood tests, but we may need all that year, right, to make sure that has not progressed. So typically when they come to me and they have seizures, depends on the age, we may be based on the clinical history, we may want to do bile acid stimulation, but majority of the times we're going to go to MRI. We're going to be straight away going to MRI. Of course, we have made sure that the glucose is normal. Okay, so that is something that is fast and easy to check. As long as the glucose is normal, majority of the times with seizures, we're going to go to brain MRI.
Incredible. And obviously, this is where you start having a discussion on the ability to be able to work up cases, because there are financial implications to a comprehensive workup versus, let's wait and see. And in terms of the patients, before we move on from the idiopathic ones, how frequently would you say is fine without medication before you saying, actually, we need to now include medication as part of the treatment regime?
Yeah, so that's a very good question. We're talking in that idiopathic, right? Between 6 months and 6 years. Because as I said, if there is an underlying condition, after the first seizure, you need to start treating. But if there is no underlying condition, if it's idiopathic, so there is that imbalance, the plain or blank advice will be, if your dog or cat has more than one seizure in 24 hours, what we call clusters, we need to start treatment. If your dog seizures or cat seizures are getting more frequent or longer, we need to start treatment. If you have had, for example, 2 or 3, and they all have happened every 2 or 3 months, and they haven't again increasing frequency or intensity, there is not like a clear number. Some people will suggest if you have more than one seizure in a month, probably they will advise it. I leave it a little bit subjective because I think it's important for the family to discuss. Once you start treatment, the treatment is for life. So are we going to commit for that? Can we give medication twice a day for the rest of the life of this dog? Are we going to be able to pay for it? Are we going to be able to follow it? So for me, the blank ones are cluster seizures and increase into intensity and frequency. The other number, it needs to be discussed with the family.
That's really great advice. And I mean, I agree. I compare it to, and a lot of people can associate with the diabetics, the ability to give insulin when needed. This means, you can't, necessarily go away without finding someone who can medicate your dog or cat. Yeah. Obviously that's a big thing. And for a lot of owners.
It's a big thing. And we know that the quality of life of an epileptic dog is related to the quality of life of the pet parent. If a parent doesn't feel that they have a quality of life because of what they've been imposed to them in terms of medication, they will consider that their pets do not have a quality of life. So it's very important as a vet that we need to save time for this conversation. This cannot be a 5-minute conversation. This is a half an hour conversation where you need to understand the environment of that patient and how can you make this treatment work for that specific patient and family.
Now, I know I have a very limited time with you and I don't want to miss the opportunity for us to work down the body. And I know if our listeners are really keen that I can approach you again so we can really deep dive. But tell us when it moves outside of the brain and the head and down, tell us about the neurology of the different parts of the body and those kind of presenting signs.
Yeah. So I think that the disease that we see more often will be, seizures, meningitis, what people call meningitis, okay, which are different from humans because they are not contagious. They are most of the times immunomediated. And typically, most common is that you will see or you will have a very wobbly dog, okay, a dog that walks like he's drunk. That will be neurological. Could be something as simple as an ear infection, or it could be something more serious like meningitis. But walking like you're drunk, that is neurological. And then the other big one will be anything related to having a compression into the spinal cord, so not being able to walk properly, whether that affects the forelimbs or just the hind limbs. And that could be related to having a slip disc or to having also, for example, a tumor. But it's true that a slip disc probably will be, after seizure, the most common neurological presentation we will see. And you will have a dog or a cat that don't want to jump, they're struggling to walk, they walk like they are drunk or they are dragging. That's going to be the most common presentation.
And there is a lot that you do, obviously, as part of your clinical examination that owners may not even, unless you talk it through, may not be aware of. A bit like, the very basic clinical examination that we do as GP vets from, nose to tail or whatever your system is. Yeah. There are a lot of tests that you do that are establishing what is involved. Take us through some of that so that owners understand some of the testing that you do, obviously after the history taking.
Yeah, to be honest, I'm less of a hands-on neurologist because I do have a lot of experience observing, and I spend much more time looking at the patient, walking around the room and taking the history. The context, the clinical context to me, the way that I work, I'm not saying that everyone does it like this, but to me, the context is way more important than my specific neurological examination. The things that I'm going to be looking, I want to understand if this disease is progressive, if this disease is painful. These are the key questions to me. And that is going to help me with the differential diagnosis. The anatomical localization, is it in the brain, if it's in the spine, I'm going to be able to assess the way that they are walking. But yes, sometimes we do some tests to really find out, is the problem in the brain, is the problem in the spine? But again, to me, the thing that I cannot reinforce enough, because when I'm lecturing all over the world, I see that there is a big lack of clinical history. We need to understand if this condition is progressive and if it's painful or not. That context is going to help me differentiate it. Is this a tumor or is this a vascular disease? Okay. Yes, knowing where it is in the body is important, but as we are also having more advanced MRIs, we sometimes can almost do the whole body. So localizing sometimes is not even as important as it was in the past when we were very limited. The context, the clinical history, super, super important. We need that information. So when pet parents come, if the husband is coming, they need to have the whole history from the wife, because many times we have the husband coming and there's half of the history missing.
That is so true. It's so true. It's like, well, and eating, they're like, well, I don't really feed the dog. And what about this? Well, I don't really walk the dog. So it's very typical. It's worldwide. So there are obviously a few red flags that go off, with your experience in terms of this from a prognostic perspective is not great. What are those sorts of things that you are able to identify even without MRI that say this is going to be a tough conversation because I'm possibly going to be advising euthanasia?
So I guess that they are two completely different situations. One, if it's something related to the spine and to a sleep disc, is going to be how quick this dog went from running to be completely unable to use the limbs. So that is going to tell me how likely is that I will be able to do something surgically or not. So we talk about a dog that he was running 5 minutes before, and by the time that they come to see me, they cannot even feel that I'm pressing in their toes. So those situations are probably the worst situation you want to be in a sleep disc, fast and severe. And then a completely other side, when we're talking about seizures, for example, when we have seizures that they are increasing in frequency and we have a very old animal, because that is probably going to be suggesting brain tumor. So I guess that those will be the most scary situation, having a brain tumor that is not operable and having a sleep disc that has progressed very quick and the animal cannot feel their toes.
Oh, that's really insightful. And I must say, we get a lot of hit by cars, road traffic accidents in South Africa. And, that's that typical sort of presentation of, the extended, it's heartbreaking, but it becomes very easy then to have those kind of conversations. And often owners or whoever brings the animal in are not ready to hear that. They're like, there are a few things that we see that you immediately go, this is, I can't help you, nor will a specialist necessarily be able to help you. And it's devastating because some of these things are so sudden.
Yeah, that is a good point. I think that with the road traffic accident, I think it's important that we establish that if we have an animal that has a spinal fracture, that we can see it on the X-ray, and they have no pain perception, that means that when you're pressing the toes, the animal is not looking to tell you they can feel. There's nothing we can do surgically. Having a shift Sherrington, which is when they are with the extended front, that just indicated that has been an acute trauma. Doesn't necessarily say that it's a bad prognosis, but it's that lack of feeling into the toes. Those combination, lack of feeling and having a fracture, that dog is not going to recover even with surgery.
That's terrible. Yeah, so it's traumatic. And in terms of those spinal cases for vets and for owners who are now having that information presented to them, if there is no deep pain, and as you're saying, are those even worth a referral? Are there any cases that actually do okay despite those presenting signs? Are they worth a try?
100%. So, well, not 100%, but when we have a sleep disc, with no deep pain, with no pain sensation, we have 50% of chances that animal is going to walk again. 50% is a lot.
Yes.
Okay, in the old days there was other numbers. We have now proved that 50% of these cases that have no sensation, they're going to be walking after surgery. So I think that there is still a big chance for referral, but it's true that yes, we are not on the 90% that we will have if they can feel. So you're taking a risk of spending money for something that may not recover, and the stress of going through the surgery, and at the end, you may not have a dog that walks again. So it's a little bit of a gamble, but there is still a possibility. Yeah.
That's very good to know that, because obviously, us GPs historically, and we need to update that information, as do I, that, that for us was a very poor prognosis. And often, when you're trying to give that percentage success rate, 50%, as you say, is really high. So that's good to know. And the ones that obviously I know that you have to go, and I'm slightly being very cheeky. Are you okay for time? Are you rushing? Shall I wrap it up?
No, because I need to do an MRI before I go to see my consult.
Okay. So your take-home message for owners who are needing a neurology consultation, what do you want them to do in terms of gathering the right information, in terms of being able to get the most out of the consult?
Yes. So the most important thing will be, when did it started? Now that you know that your dog has a problem, let's think backwards. Let's see if we could see anything before that we thought that it was just old age. Let's really go back to when was exactly the beginning. Can you remember the day on the time, or is it a little bit difficult to really know precisely when? How it has progressed since then? Have you given any medication? Have we have an improvement with that? And do you feel that your dog is in pain? Okay, do you feel? Then we will obviously do our assessment, but also your perception is going to be quite important. So that progression and that presence of pain or not, and describe exactly what you saw. Don't try to interpret, just tell me exactly what you saw, and then we will do the interpretation.
Oh, that's great. And I mean, the use, like you say, when you're explaining the seizures, of video and documenting these sort of things are really valuable. So you can see them sort of in situ in their homes, and the way that they're walking when they're at home. That must be helpful.
Yes, exactly. Many times that's a great idea. Sometimes, especially with cats, that they never want to walk with us. Just if you can take a video of the cat walking at home, that's extremely helpful, really helpful.
That's great. So you do a lot of educational content. If people want to find you, if they want to reach out, whether, obviously they're close enough to be able to refer cases to you, or if they just want to understand more about the work you do, let us know where they can find you.
Yeah, sure. I travel a lot, and I'm going to be in February in South Africa. So if anyone wants to use my help, I will be in Cape Town. But yes, if you want to follow on ane.neuro or Neuronavet, I do also quite a lot of online consulting, and I also work in different countries. Sometimes there's certain surgeries that there's not that many people doing them, so I sometimes travel to other countries to do surgery. So yeah, sure, happy to share and help.
That's incredible. And thank you so much for your valuable time. It's really appreciated. It's been a fascinating topic to dive into. And hopefully at some point when you've got some capacity, we can tackle some more of this stuff, particularly if it's resonating with the listeners and they're wanting some more information about particular neurological cases. But this has been great. Thank you so much for your time.
You're very welcome. Thank you so much for the invitation, and I see you soon. Thank you.
Okay, thanks.
Bye-bye.
Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.